In 2007, the groundbreaking Silence is Death report is published, and the startling results spell crisis for Florida's Black community. Time was running out, so in 2008, we organized. Now today, lives have been saved and history has been made. The wake-up call went out, and sisters across Florida organized to survive. In an unprecedented show of love and support, women all over the state stood up, rallied together, and joined the fight against the spread of HIV. With a pledge and a promise, sisters have taken charge, energized to empower Black women and take control of their sexual health. The first of its kind in the nation, the Florida Department of Health's innovative initiative has changed the lives of these courageous women forever. In June 2008, under the direction of Tom Liberty, Bureau of HIV/AIDS Chief, Leisha McKinley-Beach, former HIV prevention supervisor, and Ronald Henderson, statewide minority AIDS coordinator, in working with April Hogan and Brandy Williams, saw the need to educate Black women on the impact of HIV/AIDS and develop an action plan to prevent further spread in Florida's Black communities. These statistics were a startling wake-up call. In Florida, 1 in 68 non-Hispanic Black women are known to be living with HIV. Their solution was Sistas Organizing to Survive, a grassroots, community-based mobilization of Black women in the fight against HIV/AIDS.
70% of the adult female cases were Black. 75% of the adolescent cases were Black. 80% of the perinatal cases were Black. And to have those kinds of numbers definitely was a call. It had to be a call to action to address this epidemic among Black women in this state.
From day one, Sistas Organizing to Survive made its mark in women's lives. The foundation of SOS was built around 4 key objectives: to educate Black women about HIV/AIDS and how other diseases and substance abuse increase their risk, to empower Black women to take charge of and control their sexual health, to connect Black women to HIV/AIDS resources, and to offer tools that enable Black women to educate others where they live, work, play, and worship. Driven by these core values, the results were staggering. By the end of 2008, 8 local SOS conferences had been conducted, 4,100 people had taken the online pledge, and over 88,000 Black women were tested for HIV. And the momentum did not stop in 2009.
We've been able to educate Black women around the state, women being committed to take the pledge around HIV and AIDS. They've gotten tested. Last year in 2009, we tested more than 95,000 Black women for HIV because of the SOS initiative.
As SOS reaches higher, partner community organizations are taking notice of its impact on the HIV issue in Florida.
How can I talk about it with my boyfriend or husband? Or how did you share your status with your husband before you got married? How did you disclose your status to your children when they were young? Those questions that SOS is trying to get and educate our Black women, different strategies, different ways where it'll be easier for that woman saying that I don't have to keep this inside.
Well, we think it's important to partner with organizations like SOS so we can continue to collaborate and talk to each other's points of view, understand each other's points of view of how this disease is being spread, the interactions between black males and females, and how can we improve those interactions so they can be more open to having conversations with their partners about HIV/AIDS prevention.
Sistas Organizing to Survive has caught on. As the initiative continues to grow bigger and better, the movement shows no signs of slowing down.
But I do see SOS as being used as a model mobilization strategy, perhaps being used as a best practice throughout the nation. SOS is a very basic model, and I think that it can be easily replicated and it can be used with any target population. As long as agencies or states realize that there are three goals: to educate, get women to know their status, and those individuals that do test positive, we want to get them into care.
SOS promises a long future of women fiercely determined to survive. Armed with their fervent pledge, lives are being changed one sister at a time.
I think the most effective component of SOS has been the pledge. The pledge is something that women can take ownership of. It's very personal, and it makes them be accountable for spreading the message to women that they love.
It is with love that I pledge to educate Black women about HIV/AIDS. It is my duty to empower Black women to take control of their sexual health. I will commit to connect Black women to HIV/AIDS resources. I pledge to offer tools to enable Black women to educate others where they live, work, play, and worship. I pledge to get tested for HIV, educate my sisters about HIV, and encourage them to be tested where they live, work, play, and worship. It is my duty as a sister to organize to survive. SOS was created as a wake-up call to action, a catalyst to educate and empower Florida's Black women to respond to the ongoing crisis of HIV/AIDS.
It reflects Black women. When you look at the images, you know who it's for and who it's created for. So I think it has helped to allow women to take ownership of the campaign.
I think once a young lady takes the pledge, she's committed to going back to her community and spreading the word and talking to others where she lives, works, plays, and worship about HIV.
The face of the intervention are Black women that are going out and educating others so they can relate to what we're trying to do and what we're trying. It's not like someone saying, oh, Black women, you know, when the Black women go out and speak to other Black women, they say, we are at risk. It's not, you are. So I think that's what makes it more effective because it's for Black women by Black women.
Long after the staff that helped develop this initiative are gone on to greater things, SOS will still be alive. It will still be educating Black women where they live, work, play, and worship because Black women will keep the mobilization alive.
It is each of our duty as a sister to organize to survive. Thanks for your support of SOS. Let's keep making history as we take control of our future and reach higher than ever. For more information about HIV/AIDS, call the Florida AIDS Hotline at 1-800-FLA-AIDS or visit us online at wemakethechange.com.
One of the reasons why SOS was so involved, I guess I should say, in the state was because of the leadership of the Florida Department of Health. Had not people like Tom Liberty given Ron Henderson permission to allow us to try something that had never been done before, then we wouldn't be talking about the success of Sistas Organizing to Survive. So the leadership truly made the difference.